Hello, my fellow Nigerians in the UK, in Yorkshire, in the diaspora, and most especially for our Nigerian students, singles, families back home in Nigeria. Uh, Again, I would like to welcome you again to the Nigerian Yorkshire Community Network UKCIC group in the diaspora in Leeds, in West Yorkshire, in the UK. Today, I will be giving you another update, and this one is the Japa project, health and care recruitment visa for Nigerians have now been put on the red list by the UK Department of Health and Social Care in England as of today. The UK government today have just updated the Code of Practice for International Recruitment of Health and Social Care Personnel in England. This was issued on the 23rd of March 2023 by the UK Department of Health and Social Care. And this will be affecting a lot of people that are trying to come to the UK to do health and care work, or maybe to a lot of Nigerians that will be trying to collect the 3-year health and care visa or 5 years health and care visa. So today we are just going to be giving you an update, and please, we want you to pay an attention. So recently, the Department of Health and Social Care in the UK actually have just updated their code of practice of international recruitment for health and social care, and they have now updated it. And I can tell you that they have been having meeting with the World Health Organization, and they have now got to a situation that the amount of Nigerians, foreigners that are coming, that are leaving their country, emigrating their country, and coming to the UK is really getting out of hand. A lot of agencies, a lot of recruitment agencies are using it to extort a lot of people, using it to make money. And what actually had an impact on these changes was basically that the World Health Organization wanted to update their code of practice and to make sure that health and care workforce in every country is balanced. So, for example, when you see Nigerians, a lot of doctors, a lot of nurses, a lot of care workers are leaving Nigeria, and not only in Nigeria, in all other countries in the world. A lot of their nurses, a lot of their care workers, doctors are leaving their country. So the World Health Organization has had a meeting with every country that we need to stop this attitude. We need to balance this. We do not want one country or another country to be lacking of health and care work, or workforce, all because there is one country paying one money or the other. So they have now updated the code of practice, and it was issued on the UK government database, which I'm going to be putting at the bottom of the note of this video. So when you click on the note, you'll be able to see. Once you click it, you'll be able to see. So they've issued the code of practice, and they have 3 scopes. So they have now put some countries into green, red, and amber. If you are one of the countries that is in green, then I think you're okay. And if you're one of the countries that's in red, I think you're in trouble. And amber, I don't think is looking good. So I'm going to be explaining all this. So first of all, 54 countries have been put on the red list. That means that there will not be, as from 23rd of March 2023, there will not be active recruitment that will be permitted anymore. Either you are an agency, either you are an organization, either you are an employer. So I just want to let you know, if you're a Nigerian that you're back home, there is no recruitment for care workers, social workers, and even maybe it will get to doctors, but they've not mentioned that of doctor. So the reason being is basically that the World Health Organization has issued out a list in conjunction with the UK Department of Health and other countries. So Nigeria is one of the 54 countries that is on the red list. And I can tell you, Nigeria is number 35. Nigeria is number 35. And what that means is that any country that is on the red list, these are countries, there will be no active recruitment that will be permitted anymore. So I want you to be careful. The reason why I'm issuing this Japa project warning on healthcare and recruitment, visas, 3 years or 5 years, is please, I want you to watch out. Don't go and waste your money and go to any agency. They tell you to, because on my last Japa video, I told you that now 3 years, 5 years, a lot of people in Nigeria or recruitment agency are charging 11 to 12 million. So you have to be very careful, because if you apply for a visa, if you pay that kind of a money, you know, the Home Office, the British Embassy in Lagos and Abuja, they will not issue that visa anymore, because they have now updated the code of practice for international recruitment, you know, in alliance with the World Health Organization, because they don't want everybody to be coming down, because the workforce is just like all the nurses in Nigeria started coming to UK, all the nurses in India, in Malaysia, etc. So Nigeria is one of them, and they have now put Nigeria on the red list. I just wanted to let you know that. The countries that is on the amber list is Kenya and Nepal. Kenya and Nepal. And this country that are on the amber list, there will be a government-to-government agreement with the UK government. So what that means is that any country that is on the amber list, which are 2 countries, it's just Kenya and Nepal, their government should have an agreement with the UK before they can let them in. But that is what they put them on the amber list, because there have been a negotiation in between Kenya and Nepal with the UK government. The countries that are on the green list are India, Malaysia, Philippines, and Sri Lanka. Those are the countries that I think they don't have problems. So unfortunately for us, my people, if you're there, you're a family, please, you're listening to me now, please don't waste your money. Make sure you check all the updates. I'm going to be putting that link onto the bottom of this video so that you can see the updates, okay? It's very, very important. Again, this was issued on the 23rd of March 2023 of recent by the UK Department of Health and Social. They have now put Nigeria on the red list of the international recruitment for healthcare and social worker. So that means that there will be no active recruitment of social care and healthcare, even doctors, from Nigeria. That is the latest update. And I will put the link for the UK government. You can go out there and read it, okay? It's very, very important. So again, just to go directly onto this, Department of Healthcare and Social Care in England would recruit anyone from countries which has been recognized by World Health Organization. So what that means is that any country that has been recognized by the World Health Organization as a green country, you know, they will allow. But any country that has been put on the red list, which means this time Nigeria is one of them out of the 54 countries. So the list is at the bottom of this video. You can list it. Nigeria is one of them. Nigeria is number 35, you know, and this is due to the emigration of healthcare and workforce from all those countries. So what the World Health Organization is trying to do is that it's unfair for one country to be taking the healthcare and workforce of one country. For example, all the nurses, all the healthcare, all the doctors are moving from Nigeria to UK, or are moving from Nigeria to Australia, to Canada, etc. And they want to balance the whole thing. And this is why they've had a meeting, and this is why UK is updating their database. So this is a kind of a warning, please. If you're trying to get an health and care worker visa for 3 years or 5 years, which is costing around 11 million to 12 million, please make sure you pause. If you go and pay that money, that visa will not go through. It's as simple as that. It's as simple as that, you know. So they're looking at people like having direct application to employer without organization. So you can have a direct application directly to the employer. But if you're on the list, if your country is on the list, which Nigeria is on the red list at the moment, so they will not be allowing any recruitment for now. They have now put Nigeria on the red list. So this is an update that, you know, Nigerians back home that are looking to come to countries like UK, Canada, Australia, America for health and care worker, or maybe you're trying to get a health and care visa, please, you need to understand that Nigeria has now been put on the red list, and there will be no active recruitment as from now until the next update. So this is why this Japa video, is basically, this is a Japa project for UK new international recruitment of healthcare and social care personnel, which means that Nigeria has now been put as one of the people on the red list. What that means is that active recruitment for health care, is not permitted anymore as of dated as of today. So this is just to give you an update. I'm going to put the link there again for people that are just watching this video, and I'm going to run this video up. The Nigerian government has now been put on the red list for the countries that are recruiting for healthcare personnel or workforce. And what that means is that the UK Department of Health have now updated their code of practice for international recruitment for health and social care personnel in England, and they now have 3 categories: the red category, the green category, and the amber. The red category means that no active recruitment is allowed as from now, and Nigeria is one of them. Nigeria is number 35. Okay? And the amber countries are only Kenya and Nepal. And what that means is that any country that is called amber, there has been a government-to-government agreement with the UK government. And any country that is on green country, which are India, Malaysia, Philippines, and Sri Lanka, they can carry on applying for health and healthcare visa. So this is the latest update. And today, unfortunately, I don't have a good news for you, but for people that are trying to collect, that are trying to get the health and social care 3-year visa, 5-year visa, etc. And please, just to realize that that visa is now cancelled and it will not be existing anymore because the UK government has cancelled it. So please, I want you to watch the video, and I'll be putting the link where this new information have just come from. This is the link from the Department of Health and Social Care in England. This is the UK government website. So this is the latest update on Japa project, and this one is only about the new update about the health and social care recruitment, and this means that health and social care visa, which has now been put on a red list. What that means is that it has now been stopped because Nigeria has been put on the red list, and this is due to the World Health Organization that have said that we have to balance the health and social care workforce in every country. We cannot allow all the healthcare in Nigeria or in Africa to be going to America, Australia. That would be a kind of a imbalance in terms of, we have to balance all the workforce in terms of healthcare so that we can have people in our country, in other countries that are in need of nurses, doctors, and healthcare. So this is the latest update of Japa project, and this is this Japa project is on the latest revision for international recruitment for health and social care recruitment to UK. Either you're collecting a 3-year visa or 5-year visa, health and social care visa. This has now been updated and Nigeria is on the red list. So please watch out, and more updates to come for you soon. Thank you very much. Bye-bye.